Hey everyone, my name is Gabrielle Dialli from Morehouse School of Medicine, Internal Medicine Residency, and I am a PGY3. I'd like to present a case that my team and I encountered back at Grady Hospital a few months ago. It was a very interesting spin on a diagnosis that nearly slipped through our fingers. So I am pleased to present a 56-year-old African American female with history of asthma and treated hepatitis C, who was brought into the emergency room after being found by family members. She was in bed with urinary incontinence and had some difficulty moving around, but the patient herself complained of generalized weakness for about 2 days prior to being found. She also noted that when she was getting dressed for the hospitalization, she was having difficulty. She also complained of shortness of breath and chest pain. The chest pain was across the entire anterior chest, present at rest, non-exertional, no radiation, pressure-like, and very similar to chest pain she's had in the past during asthma attacks. No headache, vision changes, sore throat, cough, no GI symptoms, no numbness or tingling in her extremities. In terms of her exam, she was overweight, ill appearing, and had a fever of 38.9 degrees Celsius, but her respiratory rate and heart rate are both normal. Her O2 sat was low at 92% on room air, but improved to 100% once we placed her on a 2-liter supplemental oxygen. Her speech was slow but clear, and she was extremely lethargic throughout the exam, but her sensation, reflexes, and cranial nerves were intact, as well as her motor strength. In terms of her labs, her CBC did not show leukocytosis or anemia, but her chemistry showed a slight bump in her creatinine above her baseline. TSH was low, but the other thyroid hormones were normal. Her ammonia, LDH, and CRP were all elevated, but troponin, syphilis, HIV were negative. We ended up getting a vitamin B12, vitamin D, CPK, ferritin, and those were all normal as well. Blood cultures, urinalysis, and drug screen were also negative. EKG showed sinus rhythm, and as you can see in image 3 on that lower left-hand corner, the chest x-ray was normal. Images 1 and 2 right above are both of her non-contrast CT head, which did not show any acute pathology. Given her mild respiratory symptoms and that one-time fever, we decided to put her on contact and airborne precautions and test her for COVID-19. Now, while that swab was pending, we went ahead and performed a lumbar puncture since she had the fever and the altered mental status. We gave her a nice round of empiric antibiotics for meningitis, but surprisingly, her spinal fluid was negative for bacterial and viral infection. The COVID-19 test came back positive after a few hours. We started her on a 5-day course of azithromycin and sent her home to self-quarantine once her symptoms improved 2 days later. COVID-19 is a novel virus originating in Wuhan, China. The classic symptoms are fever, cough, malaise, and diarrhea, but there has been increasing numbers of neurological symptoms. This is a case of COVID-19 causing acute encephalopathy in the form of psychomotor retardation. Recently, a case series was done in Wuhan, China at 3 special care centers for COVID-19, which showed that neurological manifestations fall into 3 categories. The first category is skeletal muscular injury, the second category is peripheral nervous system symptoms, and the third category is central nervous system symptoms. Mechanisms for these neurological manifestations can include neuroinvasion and maladaptive response to inflammation. This has brought forth the concern that COVID-19 is now a new neuropathogen. With this being said, it is imperative to suspect COVID-19 as a differential when working up acute changes in mentation, with or without the respiratory symptoms. This virus can cause acute encephalopathy, specifically psychomotor retardation, as seen in this particular case. So in conclusion, increased knowledge of psychomotor retardation and COVID-19 infection can lead to a more timely diagnosis and intervention, and it may even decrease mortality. Thank you all for listening.